She loved her artefacts. Crocodiles on the walls, baskets, buka baskets. She loved the Queen. The Queen was everything. We did start calling her Queen Diana for a long time there.
In early 2022, Shaz Campbell noticed her mum Diana Bourne was changing.
It was just, "Hi Mum, how are you?" Or "I can't talk. William and Kate are here." What?
Diana's physical health was deteriorating and Shaz decided her mum needed more care.
Jeta Gardens was only 7 minutes from my house. That meant I could be there. I could take her out.
What were you thinking?
At first, you think, oh, have I done the right thing? But you don't know.
Shaz visited her mum daily, but that stopped when a deadly COVID outbreak struck the nursing home.
Jeta Gardens in Logan City is facing regulatory action after 100 residents and 82 staff tested positive.
You had to call them every day, and I had to always ask, how's Mum? No, she's fine. No COVID. They don't tell you about all the rest.
When Jeta Gardens opened its doors again, Shaz found letters in her mum's room.
It's like a madhouse here. Please help me. Lots of love, Mum.
A few weeks later, she received a phone call from a nurse at Jeta Gardens.
Hi, what's wrong? We're taking Mum. We've booked an ambulance and they're coming to get her, take her to the hospital. Why, what's wrong with her? I'm not sure, she's just a bit sick.
At the hospital, Shaz couldn't believe her eyes.
I went in, there was a nurse there, and she said she's come in as she was homeless. She's so dirty. And even when I went up to give her a hug, she just smelled. The smell was awful. It was just awful. The doctor came in and he said, she was in a nursing home. And I said, yes. And he said, you need to find out what's going on here.
The following day, a nurse from Jeta Gardens emailed Chaz clarifying that a few days earlier, Diana had been diagnosed with a UTI and given antibiotics. Accidentally, the nurse also forwarded on internal correspondence where staff admitted they feared they'd be sanctioned for neglect because Diana had never been given the antibiotics she needed. While in a lethargic state, it was Diana herself that requested to be transferred to hospital.
While she was in the hospital, they found she had sepsis. She'd gone septic, so there was nothing anyone could do. It was all too late.
Diana Bourne died 12 days after getting a UTI. While cleaning out her mum's room at Jeta Gardens, Shaz made a grim discovery.
I just went in and I got all her stuff, and that's when I got the medication. Found it was unopened.
An investigation by the Aged Care Quality and Safety Commission found that Diana did not receive the care she deserved. In response, Jeta Gardens committed to change care protocols and re-educate staff. Shaz Campbell believes people should know more about a home's history before they send their loved ones to live there. Why are you speaking out today?
No other family should go through this heartache.
Thank you so much, Helen, and may I acknowledge the Gubbi Gubbi
1 month after Diana Bourne's death, Aged Care Minister Anika Wells announced a new star rating system for nursing homes.
What star ratings does is open up a nice, transparent conversation about what their options are in their community, and it gives people better information about making sure they're going into a facility that they're going to be happy with.
Rodney Jilek has worked in aged care for 3 decades and was a compliance officer for the federal government.
The systems that have been put into place to provide transparency to the general public are giving a deceptive picture of what is happening in aged care.
He's examined how effective the star rating system has been since it was introduced.
The star rating system is a purely subjective, unvetted system that I would not rely on at all if I was choosing a service for my loved one.
The star rating system was introduced by the Albanese government in response to the findings of the Royal Commission into Aged Care. It grades nursing homes based on 4 criteria: residents' experience, staffing ratios, quality measures, and compliance with government standards. Homes that are found to be non-compliant should not receive more than 2 stars. But Rodney Jilek's research shows that's not the case.
The perfect example of this is Wall's End Aged Care in Newcastle. It's a service operated by New South Wales Health. November last year, they were 5 stars. This is their performance report from their audit, and this report shows that on the 1st of November, they were deemed to be non-compliant in all 8 standards.
And yet the government's own star rating website gave it 5 stars during the same time.
Exactly.
New South Wales Health told 7:30 Wall's End is due to close as the facility is in an ageing hospital-style setting. But maybe this is just a one-off example?
No, there were over 300 services that were clearly non-compliant with the standards, but rated well above that.
She had a real passion for cooking, didn't she?
Yeah, she'd always try something new. She loved
And
experimenting.
of course, there was always happened to be a
Champagne.
bit of vinegar there.
Admitting Kath Reid into a nursing home was one of the hardest things her husband Rodney has had to do.
We sort of pledged to each other the last thing you'd ever do is put each other in a nursing home.
Rodney Reid and his daughter Steph Foley took 6 months to select the right nursing home.
No, the budget was not an issue.
Went on tours, we asked questions.
They settled on Charles Brownlow, a nursing home in Geelong that's been rated between 4 and 5 stars.
When you look at the building, you think, this is a 6-star hotel. Their brochures and information books were glowing, but I guess it was the physical things that I got lured into.
In August last year, Kath Reid's family noticed something was wrong.
I remember I tried to take her for a walk and she put a magazine on her head. I said, could she have had a stroke?
We both said that to them.
Within the following month, Kath Reid lost 7 kilos. Rodney became desperate for answers.
Who do I turn to? Who will listen? If I do raise all these complaints or concerns that I have, is it going to backlash on Kath?
Rodney brought in an independent geriatrician. She found Kath was almost terminal. For 9 days, she'd had no food and minimal fluids. Immediate hospitalisation was recommended. Hospital records obtained through FOI reveal Kath Reid had sepsis.
Sepsis. We'd never heard the word expressed up until then.
Once Kath was stabilised, she returned to the nursing home. A few weeks later, when Rodney and Steph came for a visit, they noticed 2 new signs on Kath's door.
One was a butterfly and one was a nature scene with a staircase going up towards a light, and it said "Do not disturb." So Dad and I stood at the door for a minute and we both said, what's this? And we both said, maybe she's died.
Rodney and Steph said they were never told Kath was so close to dying.
One of the nurses said, "Don't worry, she's not going to be going anywhere."
This can go on for months.
And 2 days later she died.
Rodney and Steph complained to the Aged Care Quality and Safety Commission. A subsequent investigation found Kath was malnourished, her pain was undermined and untreated, and she was given the wrong medication. 730 has also obtained records of a phone call between the home's clinical quality manager and the Aged Care Commission, where the manager said she was horrified by the investigation's findings and suggested the home should be referred to the Commission's compliance team. 3 months later, Charles Brownlow had its star rating for compliance increased from 4 to 5 stars.
How is it possible?
5 star. I don't know how you can possibly come up with that.
Charles Brownlow said some aspects of Kath Reid's care did not meet their standards, and it adopted all the recommendations the Commission made.
We put a lot of trust in how those star ratings are achieved.
The Aged Care Minister Anika Wells declined our interview request, but her department said in a statement, the Aged Care Quality and Safety Commission is responsible for monitoring aged care homes, and that the star rating is affected when the Commission has to issue a formal regulatory notice due to the failure of a provider. The Aged Care Commissioner, Janet Anderson, said if a nursing home can quickly demonstrate it's taken appropriate action to address any risk or non-compliance, then it does not use its formal regulatory powers. She also said the overall star rating is accurate and reliable. The government has commissioned a private consultancy to review star rating. In Queensland, Shaz Campbell recently learned that her mum's nursing home has been sold to Opal Healthcare, Australia's biggest healthcare provider. The audit process will now start again, meaning the facility has no star rating at all for the next 12 months.
Don't go there. Simple. Don't go there.
Opal Healthcare said that it's unable to comment on Diana Bourne's case. However, when the company took over, it introduced new management and made improvements.
You know, you're elderly, you've worked all your life, you get sick, you get dementia. You need to be careful. It's going to happen to every one of us. It's very sad. The nursing home thing is very sad. And I lost my mum to them.
Your contributions have been vital to reporting on aged care, driving that Royal Commission. So if you know more, please contact us on 7.30@abc.net.au.